you all are here. And we are also going to record, which we just started now. And I'm going to hand it over to Ashley, and then we'll come back to the goals and the logistics of the meeting.
So I'll unmute your volume down. Okay. So we just want to start by recognizing how horrifying last week's decision was, and we couldn't more strongly disagree with the decision that was made to, strip healthcare from women. So not that we know what to do, and I'm sure many others have other resources, but we just wanted to acknowledge that. And I don't know, it's a little bit like there's no words for it, but people are doing awesome work, and it's not the work we're most directly doing, but we just want to share a couple of resources, and there's more. So we'll share actually more in our newsletter. But if Amanda could drop in the tool in the chat, this is just one toolkit about kind of how to help and where folks can get help across the country. And I came across this this toolkit, and the place that I'm starting to donate every month, and I would welcome all of us doing that, obviously, is just abortionfunds.org that helps across the country. So I wish we weren't facing this, but it's time to work together. So we just wanted to acknowledge that as we start.
Alrighty, excellent. So I'm going to start just by sort of grounding us in terms of what the goals are for this meeting, and some of the sort of logistical things. So this meeting is going to be a lot of me and Ashley talking, which is good and bad, I'm sure. But we want to hear from you all, and there will be time during the meeting to hear from you all. But we also have created a Google form that sort of moves along with the meeting to allow for feedback. Ashley, if you don't mind putting the link to that in. Oh, okay, I'll put the link to that in the chat in a second. But the goals for this meeting are to briefly review where Climate Health Now has been, to share with you all what we have learned, both through the process of founding CHN and through the listening campaign and work with Building for Mission that we have been doing, and then to really share the vision of where we are going from here. So we'll walk through all of that. I do want to just acknowledge and extend a welcome to two people on the call from Building for Mission, Hazel Monet and Natalie Thomas. Many of you have had the fortune of getting to talk with them, and we're really grateful for them being here. They are going to help us just with chat monitoring and note taking. And again, thank you, Natalie, for putting the Google form in. We hope that you all will follow along with that. All righty. So I am going to start just by reviewing the brief history of Climate Health Now. And for some of you all on the call today, you have been here from some of these very, very early moments. So Climate Health Now, it came into existence around the fall of 2019, when a group of health professionals came together to support the youth climate strikes, specifically working on a lobby day in San Francisco to coincide with the youth climate strikes. For me and Ashley, this was especially meaningful because Ashley and I know each other because she is my doctor. And shortly before September of 2019, I had ended up in her exam room talking about my own climate anxiety, and she had invited me to join this lobby day and to be a part of helping to organize it. Since September of 2019, we have grown to include over 600 health professional health worker members across the state. We are the state affiliate for the Medical Society Consortium, which probably most people on this call are familiar with, but if not, they are based out of George Mason University, and are a group that collectively represents over 600,000 health professionals in the US. In our 2.5 years, we've participated in legislative and regulatory advocacy efforts. I'm not going to go through these in detail. We've listed a few of them here.
No, we
And we've
changed
also
our address
organized
kit,
and moved through what
and
we
I think
call
we've
the
updated
CHN
the address.
Catalyst Collective, which wrapped up a few months ago, which was an
Okay.
introduction and course in community organizing specifically for about 15 CHN members.
That's correct.
And we've also invested in the last 6 months in something called PowerBase, which is a organizing database for community organizing groups. And we just wanted to share quickly 2 sort of screenshots to give you all an idea of what PowerBase enables. But it's a way of really understanding who our members are and where they are, down to very specific detail, including, what congressional district are they in, what state Senate district are they in, and then because we're interested in activating organized medicine and things of that ilk, we also are able to to ask members to tell us, okay, what CMA district are you in? Okay, let's look at everyone who's in that district, etc. And actually, if you want to go backwards, sure, we just wanted to share a few highlight pictures. So the first 2 pictures are from that very first lobby day. The one on the left is in then California Senator Kamala Harris's office with one of her chiefs of staff. The one on the right is the first time we ever set up our urgent climate care clinic. You want to go forward. And then just some other activities that we've been involved in. The bottom left is the only press conference we've ever hosted, which was a really exciting event, and just more pictures of us in action over the last 2.5 years.
Okay, I'm gonna come off mute. Okay. So we have we've learned a lot. I think we've tried a lot, and we tried a lot really driven by passion and love, and in all of that trying, we've learned a lot. And so we're not at all going to go into the depth of it, but this is really what's informing our structuring in a really intentional way is what we've learned. So I'm sure more people could add to this, but part of this is just those almost 3 years together. Part of this is the listening campaign that 9 of our members actually tried to do one-on-one meetings with as many of our 600 members as possible. And part of this is informed by the listening sessions that Natalie held with many of our members. So it's really clear that our members find CHN to be, to feel like a political home. Like this is really the sense of where they can get engaged in politics. And there's really a sense of belonging to CHN as members. It's also very clear that our members have very limited time. So we're really busy, and there's that quote of, if you want something to get done, give it to a busy person. So we're hopeful that's sort of an asset also, but our members have made it really clear that that the desire is there for us to kind of line up really clear actions to leverage their trusted voices because their time is really limited. It's also very clear that we don't have the resources or the capacity to really closely analyze and track legislation. So it's very clear that needs to actually be something that we use the strength of others to support us, but that's not our greatest strength, is the details of advocacy. A lot of the messages we've also heard is that being involved in climate activism really gives a sense, and I can so speak to this in my own experience, a sense of really profound meaning, and that being working on something that's much bigger than any of our day jobs is enormously meaningful. And then one last kind of big theme is that there's a really wide spectrum amongst our 600 plus members of confidence in speaking about the health impacts of climate change and speaking about health equity and climate change. And so we have a big opportunity there to, get everybody feeling a little bit stronger on that. And then, through the listening campaign, we definitely heard interest in actually many different areas of work. So decarbonizing our own sector through healthcare. There's a lot of interest in that. And Amanda and I joke about this, but it's sort of like the gateway drug to get new members involved and feel like they have the capacity to make change. A lot of times that's in our own clinics, in our own hospitals, those goddamn plastic water bottles that drive us all nuts because of the dissonance of what we know is sustainable and right and what we're seeing. So the decarbonizing healthcare is definitely something that there's a lot of interest in. So we're definitely bringing that forward as one of the teams that we're looking to structure. And of course, kind of foundationally, the need for education and speaking to our own colleagues, speaking to our communities and the public and legislators. So we kind of loosely call that CHN Speaks, or the education, the storytelling area. There's a ton of interest in that. And then in advocacy, really going, whether it's advocating for legislation in California or advocating for regulations, there's a lot of interest in doing that, which is why we're building that into the direction we're heading. And then lastly, there's a lot of interest in kind of working within our organized groups, whether it's the California Medical Association or the California Nurses Association, and using those lobby apparati that are already really organized, using those and moving those more towards climate and health equity, really. So those are kind of some of the broad strokes of what we learned, and that's informing the vision for where we're headed. We also, like I said, we kind of came in full of action and not with a ton of strategy. And so that's why Hazel and Natalie are working really closely with us, because this is new for all of us. I don't know too many folks on the line who've started nonprofits, but we have an awesome team helping us. And so we're putting all of those lessons learned to work in developing the strategic plan and the associated goals to make a huge impact right now, like this summer. That's what we're working on. It's also really clear, and I have a lot of sadness actually around the fact that the lack of structure that we've had till now and the lack of clear decision-making processes, a lack of really clearly defined leadership roles has caused a lot of challenge and been really difficult. And I think a lot of kind of friction could have been avoided if we'd had that structure. So coming from a growth mindset, we're creating that structure now so that we can really scale and eliminate that extra challenge, because there's enough challenge. We don't need it to come from just a lack of structure. And then lastly, that we haven't focused as much as we need and want to on diversity and inclusivity. And that's something that we're really putting in the center, because we want to, make the community of CHN really embody the community we want to see in the world, which is an inclusive and diverse group. So that's something that we're using what we've learned to build more strong and more intentionally. And then I don't know if anybody's tired of this, Amanda might be, but I think that's a really helpful framework. And so I think of it, because I'm a Marshall Gans groupie, as you know, and I think this is helpful for kind of this, to me, this really is a framework for community organizing, and that we use our head and the strategy and the, intellect, and we combine it with the values and the emotion that call us to action, that coming from our heart, the narrative, the why we're doing this. For me, you all know it's Kala, my 4-year-old daughter, and all children, and that we are combining those to inform our hands taking really meaningful, needed action, smart, impactful action. So this, today's conversation is completely anchored in the strategy. Other times we talk about the narrative and how to make, how to inspire more people to join us. But today it's all about the strategy and how we align our group to be really, really effective. Yeah. So, is it still me? You, okay.
Alrighty. So that was a kind of brief overview of where we have been, what we have learned. But I think the question on everyone's mind, including ours, is like, okay, where are we going from here? So we wanted to start by sharing something that is called the Vision of Tomorrow. And this is really a compilation of visions that were created during the Catalyst Collective, which we mentioned, which took place over the summer, which various CHN members participated in. This is a result of Ashley and I working directly with the Building for Mission team and integrating feedback that we've heard throughout the focus groups. But our vision of tomorrow is that we are a large community of diverse health professionals and health workers across California who are a powerful contributor to the broader climate justice movement for realizing health equity through policy level climate action. We see all our goal really, not through CHN or not, is that all health professionals and health workers across California are engaged in climate activism and see climate activism as an extension of our health work. We also want to create a community that is fulfilling for its members, providing a sense of belonging, a sense of home and comfort. One of the things that comes to mind for me was, I think it was now 2 summers ago in the summer of 2020, when, for those of us in the Bay Area, we couldn't see the sky because there was so much wildfire smoke. And one of our members, who is a psychiatrist, Madeline Lansky, in San Francisco, offered to host a webinar that would just be a free space for members to come on and talk about what it was like living at that specific moment in time. And that's the kind of place that I want for CHN, and that I think a lot of, I hear and see from a lot of people that they want as well. Can you unclick the update is available? So our mission 2.0, because we've had other versions of our mission before, but this is, informed by many more things, is that Climate Health Now is a group of members of the California health community who advocate for climate action through a health and equity framework. We use community organizing to build the base of climate engaged health, allied health, and healthcare administrator professionals across California to leverage our trusted health voices in support of the climate justice movement in order to protect health and achieve health equity.
I don't know about you all, but that makes me pretty excited. It's kind of like it is our call to action, really. So do we have something about that in the form? No. Okay. Okay. If you want to write in anything about the mission in the Google form that you have, we would welcome that. And I just want to also name that we're going to have a pause for questions and discussion shortly. So that's coming up. So let's see. So our theory of change. I didn't know what a theory of change was about a year ago. So I'm just going to start by saying kind of what that is. And it's definitely, I've really only heard of it in community organizing spaces. So a theory of change, I'm calling on Professor Marshall Gans, but it's how we can use our resources to achieve the change that we want to see in the world. So our theory of how CHN can achieve the change and achieve the mission that Amanda just talked about is that if we organize and enable California's health professionals and health sector, health workers to put pressure on policymakers and decision makers, then we will see bold, urgent system level climate solutions because of the unique social trust and influence of our professions on public opinion. So this is, how this is kind of the root of what informs our strategy is, I think, I've shared this a lot with other people, but when I first was trying to find my home in the climate movement, I started with Citizens Climate Lobby, love them, but I felt like anybody can join that. And I felt like as myself being a physician, I wasn't using my greatest tool, which is my professional trust. I wasn't using that. And so that's why CHN's really anchored around are using that unique social trust, whether it's you're a midwife, whether it's you're a nurse, whether it's an acupuncturist, whether you run the hospital, that trust is so unique. And that's what we're trying to leverage the heck out of to protect everyone we love, and all the things we love. So that's the theory of change. And then I'm going to share a couple of visuals to kind of bring that, different perspectives on that. So this is a visual that to me really is the same, explaining the same thing, but what we have to leverage is our trusted health community voice, around the value of human health and safety. And that's what we're trying to leverage in order to build up that support for bold climate action. And then, so that's one visual. And then another visual, actually, I'll go to this first, is that and this is kind of pulls in the community organizing piece, is what we're trying to do is kind of get all of our members across the state to use our tool, our social trust, most effectively, and to do that in an orchestrated, coordinated way around advocating for climate action in California. And so I'll go back here is, so I'll take a pause there because we're doing okay on time. So if anybody wants to share a question or two, we could take a pause and then I'll go into what community organizing is. And I have my volume down. So I see, Bob, do you have a question?
Oh, I think you're muted, Bob.
Unmute.
There, we can hear you now.
Okay, good. First of all, this is terrific. I mean, it's really come a long way. I'm really happy. Thank you, thank you, thank you. I just want to mention, in terms of voices being heard, to mention the contact with patients is important. And yes, legislators, but a simple single sentence with a patient, how many people do you reach every single day in your clinical work? And I think it should be in the mission statement as well. It's vital and valuable.
Yeah, we see a lot of patients. That's a good point. That's a good point. Yeah. Thank you. And and then also, if you want, we would welcome another question or two. We really want to hear your feedback. And if you want to go to the Google form and share your thoughts there also, that would be great too. Anybody else? I know we talked about theory of change more in the community, in the Catalyst Collective. If anybody wants to chime in. No? So Anita in the chat saying that by definition as healthcare workers, how/when would our mission include actions outside of decarbonizing healthcare? Yeah. That's a great question. So it's really becoming apparent that decarbonizing healthcare is, extremely important, especially in, and we'll get to this more actually next month, but to recruit more members and to, work together to share kind of resources, and that what our opportunity really is greater. It's beyond our own institutions in coalition to advocate for system, entire community change. So it's looking like, advocacy outside of our own institutions is kind of where we'll orient as what our actions are around, and building actually probably a team that does help people who are really inspired to working within their own institution, that's something we'll also do. So yes, but our work is definitely beyond, includes our own institutions, but is beyond our own institutions. Yeah. Okay. So we'll keep going. Okay. So just kind of, again, stepping back, because we've talked about community organizing, and you all know I'm a groupie, and there's different senses of that. I think the first community organizer I ever heard about was President Obama. Was probably the first person to put it on my radar, followed by Dolores Huerta and Cesar Chavez. But to just define it, is that, and there's probably other definitions, but the one we're working from, and just the idea, is that community organizing is generally engaging a body of people, which often is referred to as a constituency. Constare, I learned from Marshall Gans, means to stand with, to stand together. So that's the constituency piece, is the people who care about a particular issue and increasing their influence on solutions for that issue by organizing them towards a common goal. So it's finding your people who care about the same thing and working together to effectively make a difference on that. And really importantly, we'll also talk about the snowflake model of community organizing, which, there's kind of organizers in the center who work together to identify leaders in the community, who then work together to build teams and create more leaders. And this is scalable. Like, this is what Sunrise Movement is doing. This is what, the farm workers did. This is what the Montgomery bus boycott was built on, is these snowflakes of people kind of coming together to make social change, which is really exciting to me. So then that's the big picture kind of frame of community organizing. And CHN's more specific kind of style, I guess you could say, can't see my thing. Okay, is that we're engaging California's health professionals and health workers who care about climate and health equity to increase our capacity to advance policy level climate action. And that's why we're orienting our action around state level action, not only within our institutions. That'll be a part of it, but the bigger frame is really influencing our state as the 5th largest economy to make a dent in slowing down the warming. So any questions about community organizing or comments, or? Y'all ready? Y'all ready to jump in?
I was going to say one thing. I also wanted to just add one thing that I think, now I'm looking at this, that is not quite on this slide, that I would like to add also, is for CHN style, engaging California's health professional and health workers who care about climate and health. I would also add to that, we are engaging people so that they will care about climate and health, and bringing, I think a large part of what we want and what we hear from members is we want to help people connect these dots and to understand that how climate change is a health issue and why it's important that we are all speaking about it. So I would just add that as another bullet there.
Yeah, any other thoughts or questions? Okay. So then we'll come to the dynamite. And this is a thing that Natalie taught me and Amanda actually, and we've talked about this visual so much that I thought it would be valuable to share. So this is medicinal dynamite. This is dynamite to heal the future for and the present from warming. Okay, so it's a positive thing actually, but with some groups, like I would actually say the Medical Society Consortium is actually an example, as I understand it, of a network. You know, so it helps to bring people together, to share resources, to share kind of ideas and education, but there isn't a really concerted coordination of action. And that's what maybe it in some ways they're organizing, but what our vision is for CHN is that we have really clear ways that we invite our members to take our medicinal dynamite of that social trust, our resource, right? Take that resource and use it in a really coordinated way to be super effective in, you know, whether it's kind of the tipping point for a certain climate justice related bill or regulation. What we want to do is to help coordinate all of our members taking action together in a way that because of the additive effect makes a big difference. So, you know, if we put that dynamite all over the place in different places and it wasn't strategic, it's not going to make a difference necessarily. But if we do that in a really strategic way, then we can make some progress. So that's kind of the visual for the community organizing framework. So we built in some time. It's amazing. We're running ahead of time. If there's, you know, based on anything we've shared, any questions, feedback, answers.
Google form.
Yeah, and also if you want to share in the Google form, because there's some questions about the theory of change and your feedback there. So whether you're an extrovert or introvert, we'd love to hear your feedback. This is you.
Yeah. Go ahead. Okay. Sorry, behind us there are some squirrels that are, it's hard to tell what they're doing, but it's very loud with squirrels here. So we'll keep going. I think we're, as Ashley said, we are ahead of schedule, so we can slow down and allow more time. So one thing we want to talk about now is who our members are and why. So, and this is, I think, also something that we've realized we want to make much more explicit than we have to date, and be really intentional and thoughtful around. So our vision for who our members are any health professional, health worker in California, basically anyone who is on a healthcare team, be it in any, you know, in any sort of role. For, I mean, Ashley mentioned before, like you run the hospital to the x-ray technicians, the ultrasound techs, all of the allied health people, anyone who is working in health, we want to be a part of our tent, including health system administrators, public health students. You know, we know that there's lots and lots of other groups. There's, you know, groups that are specifically for medical students, specific, you know, that we don't in any way want to take members from anyone else at all, but we want to be welcoming to as wide a group of I keep calling us health people because I don't know a better term for it. I hope somebody can propose one. Healers, I don't know. We'll have to figure that out. But as wide a net as we can. We also want to increase our diversity, and I recognize fully that Ashley and I are sitting here as two white women saying we need to be more diverse, but I hope that I, you know, can communicate that is what we are actively working toward. And the why for that, which is something I think I have learned so much more about over the last 2.5 years, is that diversity is a strength, and that we need diversity to bring everyone along, to hear, to get to the solutions that will work for all of us. And so when we talk about diversity, we're talking about racial, ethnic diversity, health professional, health worker type, geographic location across California. So a big part of what we're working toward over the next few months is starting with our leadership team, building a more diverse leadership team that really encompasses these things. And I wish I had some like beautifully precise way of saying why diversity matters. I hope I've conveyed that, but it is really a core part of, I think, where our potential strength lies.
You want to add the democracy part?
No, unless you do.
Sure. So I think this will also come up because we're gonna in a little bit talk about our values and principles as an organization. But there's this notion of, there's an awesome author, Adrienne Marie Brown, and she has a really cool book called Emergent Strategy. And she writes about this idea of fractals, which, you know, being in nature, those are kind of the building blocks that there's like the micro building block that then continues to grow, kind of like the snowflake actually. So seeing CHN as a microcosm within what we want to see is part of our vision is an inclusive, engaged democracy where everybody has a voice, and everybody's different perspectives contribute to the best way forward. And, you know, CHN being a kind of nonprofit that's trying to, you know, engage people in civic action, we want CHN to represent the bigger vision of a very diverse, inclusive democracy. So that's one other way that I'm thinking about kind of why we really want our membership to represent our wider communities. So.
And this will just, I think this has already come up before, but this is a nice visual, you know, representation of why, getting back to when Ashley was talking earlier about why is it important that we are using our health voices specifically. And I think, you know, the answer is that you know, that our health voices matter to society and to people. When, you know, this is just a Forbes poll that comes out every few years looking at who, you know, when people ask Americans what are your most trusted professions, it would be interesting to see how this has changed post-COVID. But health professionals, health workers are very high on that list, that people come to us because they trust that the information that we are giving them is going to help protect their health, and people care about their health and they care about their children's health. And that's why, you know, again, it's really important that we are using that specific aspect of who we are to do this advocacy.
So in terms of our members, and who our people are in our constituency, if anybody wants to ask questions, or if you want to do the part in the Google form that's about our members, we would welcome that. You can, if you want to make a comment, you could raise your hand in Zoom or just speak out. I see that. So Robert mentioned diversity usually requires active outreach. Yeah, that's a great opportunity that we haven't. I mean, we've actually haven't done very targeted recruitment ever. So that's something that's definitely in our near future. Yeah. Yeah. Okay. Great. Yeah.
This is Lily Chen. Yeah, so this is an amazing group that you guys have grown in a short time. And you said there's 600 members now?
Over. We're upward of 600.
Wow. And this group started, what, 4 years ago, 5 years ago?
No, it was September 20th, 2019, pre-COVID. Yeah, almost 3 years.
Oh my God. Wow. So to grow that much in 3 years just shows you what a huge need people have to organize and work together for this such an important goal. So some of the dental community, because my husband, was a dentist at University of Pacific, and trying to get some of them to join this cause too. And I know you guys
Lily, you're
for these meetings. Is there a place that I can refer people to?
Lily, I think maybe try coming off, closing your video, because we can't hear you very well.
Kind of overview.
Shoot, it's breaking up. I heard that your late husband was a dentist. We would welcome the whole dental community for
Are
sure.
you hearing me?
Yeah, better.
Better.
You said something of, yeah, if you want to type your question, but you said something about where you could refer people, and then we couldn't hear anything else.
Okay. Okay. All right. Can you hear me now?
Yeah, that's better.
Yeah.
Is this any better?
Yep. Yeah, go ahead.
Yeah. Okay. Yeah, so I was wondering what is there a place on the CHN website where I can give people kind of a broad overview, or maybe a video introduction, or something like that? Okay, so I was wondering if there was a place on the CHN website where I could refer people to give a broad overview of what we do and what this is about.
Yeah, Amanda's going to take
I
that.
know some of these meetings are recorded, but is there like an intro video?
Yeah. So Lily, that is a great question. Our
I'll type
website
it
is
in
not very good at all. The brief answer to that is there's not a great, we don't have that very well. Shun, who just entered into the chat, which audiences are you thinking of, Lily? So Shun, for anyone who doesn't know her, is a nurse practitioner in the Los Angeles area who has been working a bit on the website recently and has a really amazing vision for what the website could be as a way of welcoming people in. So I think, Lily, I think we'll kind of not go too far down that path at this point, but I can connect both of you and say that it's something we know we need, and hopefully we will work toward it. And we're going to actually come back to this in a few more minutes too, when we talk about fundraising and hiring someone to help us with things like the website.
Yeah, great question. And thank you, Shwin, for being here. So this is kind of the last big content thing that we'll share for today. And this is a lot of words. So I apologize for that, but we just want to put it out there and for sure get your feedback. And this is also in the Google form. But in brief, in the kind of big picture of the culture and the community we want to build together with you and all of the other health professionals in California, is that we start with climate health, because we are the root and the kind of key salient aspect of our identity is that we're about health. So our identity as health professionals and health workers is central. We understand this is an emergency. This is not something we have the luxury of time to address. So there's always the fierce urgency of now is with us, while also acting kind of, this is Martha Dina Arguello, but she says working at the speed of trust, which I also it's a balance, right? It's that tightrope of the situation we're in, but we fully understand there's an emergency and act accordingly. We really embrace the fact that we're not all affected equally, and that we believe that the solutions need to lift up and protect the most vulnerable first, and be guided by those most vulnerable first. We value diversity and inclusion. Many of you probably know of the awesome writer and leader, Heather McGhee, who wrote a book called The Sum of Us. And so this principle is that we reject the fallacy of the zero-sum mentality. And we believe that when the most vulnerable among us are protected, that we all benefit. So we don't believe that we lose something if somebody else gains something. We believe that, the healthier we all are, the better off we all are. We act in partnership. We really embrace collaboration. We realize that, we're part of our huge communities. We have our tools to give, but we really want to anchor ourselves in partnership. We want to move upstream. We want to treat the root cause of the problems. We realize that the care that we give in our clinics and hospitals, and the public health kind of measures that many have learned about, those are all really important, and we want to use our tools to make the determinants of health actually determine that for everybody in the face of the climate crisis. And then lastly, kind of woven through all of it, is we really value humility and collaboration. And there's some people who talk about community organizing can be transformational. And I definitely can speak to my own learning as a person that has come from the work in CHN, and I've learned from environmental justice leaders about blind spots that I didn't know. And those were hard, and we really want our community to be about embracing the fact that we're all growing. We all have blind spots. None of us are perfect. I will be the first to admit. And we welcome being transformed by this, that this work is deep, and we value that. Yeah, that's right. Those are the beginning of our principles. It's a long document. That's a draft also. So there's room in your Google document, hymnal, to make comments about those principles. And we would love to hear your feedback. And I'm loving the chat going on here. So yeah, please do share your feedback on those. And then we're close to wrapping up. So any thoughts, feedback? Do we forget anything? Awesome. I really appreciate seeing that, see that diversity is one of the drivers for your involvement, which actually gives me goosebumps, because I think we're finally heading in the right direction, and that really is affirmative, because we want that to be something that attracts more and more and more and more people to work with us. So that's really awesome to see. Yeah, so Amanda's going to close us out with where we're heading.
Okay. Okay. Alrighty. So, go back. Yeah, perfect. To where we're going from here. Okay. So, in terms of what's to come next, so there's a bunch of things on this list. We are continuing to work with Building for Mission, and Natalie and Hazel specifically, who are both on this call, who we mentioned at the beginning, working over the course of the summer on strategy and structure building, continuing to get member input, and starting the processes of recruiting and expanding our leadership team. We will have another all member update like this one coming up in about 5 or 6 weeks, July 27th. I will drop the link for that in the chat in a second. And then our goal is to hopefully start recruiting and building teams in a few, in another few months or so. It is really hard to not be acting. I think that's one of the hardest things. I mean, as the picture we painted, at the beginning was we came out sort of swinging, like we're going to do a little bit of this, a little bit of that, and do something. And this process of stepping back and really evaluating and trying to be thoughtful and intentional is really hard. I feel it in my bones, to be honest, especially because of the urgency with so much that's going on. But it's also, as we've seen, the only way forward. So we hope you all will be able to join on the 27th. And before that, we'll also have, we didn't put it up here, but we also have some more educational stuff coming up on the 20th. We are going to hear from a really cool panel of 3 people: Linda Rudolph, who spoke a few weeks ago about the call to action, and then she's going to be joined by Naila Popardin and Will Barrett, who are respectively from Climate Plan and American Lung Association, talking about how the call to action, which is a policy platform, applies to California legislation and regulation now, and opportunities for advocacy. So stay tuned for that too. That'll be coming. We'll advertise out more about that soon. We're continuing to fundraise. Ashley's going to touch on that in a little bit more detail. Go ahead.
Okay. Let's see. So it's crazy, but we've actually raised $114,000, and we spent half of it, but for good reasons. So this year we really want to resource CHN's work and make CHN somebody's day job who doesn't have, like, clinic obligations to balance. So we basically need to raise $46,000 more to start hiring a staff member to supercharge our impact. We had the member donation drive in May, and we raised $14,000, which was awesome. And thank you so much to so many of you who did donate to that. We recently did a fundraising workshop with the consortium, thanks to Bev and others. And they talked about, at the end of a lot of religious institutions, they pass the hat. And this is basically, we're passing the hat. And that's an effective way to do grassroots things. So if you are into it, if you want to, this little QR code goes to our donation website. And we are a 501c3, which means tax deductible. We're also 501c4, but so we're on our way, and we really want to hire somebody soon. And then, of course, we're also organizers, right? So how can more folks join? They really just have to go to our website, which is climatehealthnow.org. There's a very prominent red join us button. And I hope it's really clear to everybody, and please share this out, that any health professional, health workers, psychologists, acupuncturists, medical assistants. I recently invited my medical assistant. She was like, what are you doing? I was like, come on, it's gonna be fun. So we welcome them joining. We want this to scale. We want to have thousands and thousands of members who can show up across the state to help catalyze climate action and bring about health equity through climate action. So they can just join our go to our website to join. And it's a miracle. We've finished on time. I really appreciate all of you joining, and we have time to kind of discuss. If you want to finish the Google form, we'll definitely take a thorough look at your feedback and really want to hear that. So yeah, we have some space. If anybody wants to make comments or just do the Google form, we would like that. Yeah. Oh, sure. Yeah, I think so. Yeah. Yeah. Any ideas, questions, feedback? I'll share this unless somebody else wants to, but so Gary Pace is a family medicine doctor up near, are you still in Lake County, Gary? And a health officer. And I met Gary very early in my kind of trying to find climate concerned colleagues. And Gary sent me a copy of the book many of you may have heard of, The Ministry of the Future. It's bigger than most Bibles, and it's been around the house. I haven't gotten to it, but my husband picked it up, who's not as climate concerned as I am yet. And I want to thank you, Gary, because it's a book about the future and climate, and but it's like a fiction, you know, I don't know, it's sort of real. It's very realistic, but it's written as fiction. And it's really helped him to feel more concern for the climate crisis. So thank you, Gary. You've changed my family dynamic a little bit. Interesting book, Ministry of the Future.
Lily's question about can people outside of California join? You want me to answer that? Yeah.
Okay. Oh, sorry, Lily, that's a really good question about can people outside of California join? So we're really focused on California. Essentially, I think the answer is we would love to have them we're through Powerbase that we mentioned earlier, we now have much more capacity to do things like have somebody sign up to receive only a newsletter or occasional email blasts or things like that. But we really we're working to build our community of California health people. So I think really those are our members. But we certainly, I'm certainly, on the email list for other state, climate clinician groups. And I think we would welcome all of that so that we have a sense of what others are doing. Yeah.
Oh, and speaking of which, Elizabeth Pinsky has joined, who is a fellow across the country climate climate activist. So we're glad you're here because you run Climate Code Blue, right?
Yeah, we're Climate Code Blue in Massachusetts, and I apologize. You guys were very generous to invite us, and I joined late, so I'm hoping I'll be able to catch the recording afterwards.
For sure, we're glad you're here. Lots of solidarity. Yeah. We could probably wrap up. Yeah, we can wrap up, but we're really glad you're here. I can't overstate how meaningful, being a part of CHN is, and being a part of this community as a primary care physician is hard to articulate, but my sense of burnout has eased up because of being involved in climate activism with other colleagues. And I think there's such a meaning to be found here. So we're really excited about where we're headed. We want you to be with us more and more and more active. And please do stay tuned for next month when we share more about the structure that is going to support the strategy that we're working towards. So thank you all. Hope you have a great day.
Bye, everyone.